Hello, everyone. I am Aviwe Funani. I am the Senior Policy and Advocacy Officer at United for Global Mental Health. And I am here representing the perspectives of young people as well as young mothers. I have Theo here. Theo, please introduce yourself.
Hi everyone, my name is Theodora Khofi and I'm a student at the University of Global Health Equity here in Rwanda, and my background is in psychology and HIV programming, and I'm here representing the perspectives of adolescents and young women.
Thank you so much. So, we had a session 2 days ago on adolescent mothers' mental health, and you were one of the young people in that session. Can I just find out from you, what is your perspective on young mothers' mental health from that session?
Yeah, I think for me, it was really enlightening, and it was interesting because I come from a family where a majority of my aunts and cousins were young mothers. So mental health is something I'm very interested in, but I never got to see that perspective where there was that connection of young mothers' mental health and how we can really help this specific target population. And some of the things that were said by the speakers of how they have such like specific needs because they're mothers, but they're
Yes.
also young. So somebody said like you're having this time period where you've just given birth. There's
Yes.
all of these like perinatal depression and all of these risks.
Yeah.
But then at the same time, maybe you're an adolescent or maybe you're a young woman, which also comes with so much other vulnerabilities. So
Exactly.
seeing that interlinkage and getting to discuss that was so interesting. I really
Thank you
enjoyed
so
it.
much. And one of the things that, was raised in that session is around the power of community and supporting young mothers. And what is your perspective around solidarity for young mothers and of young mothers?
What I really appreciated about the session was that one, there was representatives from people within the community and people with lived experience. So people weren't talking about this just from a technical perspective. They knew what they were talking about because they had been through it. And my perspectives on community specifically is I think it's so essential because um, you can't like you can't just focus on like the health aspect. You can't just focus on the education aspect. You need the whole community and all of these sectors to
Yes.
work together to help somebody. And yeah, it was just great to see how all of these organizations are taking a community orientation towards
Yeah.
this, and
Yeah.
it's a bottom up approach. So
Yes.
like you're working from the grassroots level, and I think that makes so much of a difference as
Thank
well.
you so much. And then the last question is, from that conversation, what do you think the future of young mothers' mental health looks like?
Yeah, I think one, it's important that we're having these conversations so we're not ignoring this topic. And like just in general, global mental health and mental health is something that's blooming. Everybody's talking about it
Yeah.
much more. And the future that I see is integration,
Yes.
where we're having like mental health and young mothers' mental health being put into like primary health programs. So when
Yes.
you go to the doctors, they're going to ask you for your ANC visits and all of these things. They're going to ask you about what's your health like? What's the baby's health like? But
Yes.
also, what's your mental health like? And I hope to
I
see
love that.
people
Yeah.
who are health workers trained with that perspective in mind so that we're also acknowledging young mothers' mental health.
Thank you so much. I
Thank
appreciate that
you.
on behalf of the Being Initiative. Thank you for joining our session and sharing your perspectives.
Thank you for having me.